Thank you, Joe, and thank you to everyone for inviting us here today and for sticking around. So my name is Anna, as Joe very kindly introduced, and this is Shayda. And today we're going to be talking a little bit around working well with the public in data research. So I don't think we need to go into too much more of our background because that was such a good introduction. So we can just get going. So before we start, we just want to get a temperature check in the room. So when I'll read out this, and then when I read out each statement, you either raise your hand if you feel like you're that person or you're not. So how confident does the room feel about engaging the public with data research? So A, raise your hand if you feel like you do it all the time. Okay, great. So do you want to, should I give you the mic then? Fab. Okay. So B, I've dabbled. Okay, cool. Getting a bit warmer there. C, I've heard of it, but I haven't done it before. Okay, a few over here. And then D, and this isn't, you don't get low marks if you set this, but this is the first time I've heard of it. This today at the conference is sort of the first time I've heard about this. Okay, that's good. So we're kind of floating around the B and C, which is great because that's who we've kind of pitched this presentation at. But it's great to see that there's quite a few people in the room as well who feel quite experienced of it. And I'd love to speak to you afterwards as well. So let's just rewind a little bit. Why work with the public? Your work could get done anyway. You might not even need to involve the public to even just get your work done. So why bother? Why are we here? Why do we get paid to do what we do? Well, there's many reasons, and I'm sure there's many reasons that go beyond some of the things we've highlighted here. But these are just kind of 6 key ones that we do come back to. So first one is identify priority and needs. So what are the needs of the research? What can your research really address? You can gain real-world insights from people with lived experience or just people who might be interested in the work. Co-produce solutions. So again, work with the public, work solutions out with them. Jan and the rest touched on that earlier. Enhance transparency and build trust. And I think this is a big one, especially for data research, because we're working with public data. We have a social contract to use that data. And at any point that really could break down if something goes wrong. So I think really making sure that you're building transparency and so you can build trust into the research process to strengthen that social contract that researchers have with the public. Improve decision making, make better decisions, the more the merrier most of the time. And also just generally strengthen communication and reach. Again, the public panel earlier did retouch on how just even subtle changes in language can make a big difference when you're talking about data. And especially because I think with data research, dare I say more so than in other scientific communication spaces, has a lot of quite complex and quite emotion-driven issues as well when you're talking about data privacy, data breaches, and then you get into the other details as well. So I think communication and reach is a really, really key one. Of why working with the public can be so beneficial to you and the public as well. So we wanted to touch a bit on definitions here because I think engagement and involvement can mean a lot of different things to a lot of different people. So we've just used 2 definitions that we at HDR UK use in our patient and public involvement engagement strategy. You might feel that engagement means something slightly different. Involvement means like something slightly different, but this is kind of generally what we use. It's not right or wrong, just is. So here we use engagement means that it describes the many ways in which the activity and benefits of an organization or research can be shared with the public. And it's a 2-way process involving interaction and listening with the goal of generating mutual benefit. And that definition is from the National Coordinating Centre for Public Engagement. It's a very good resource for general public engagement if you haven't become aware of it yet. And then involvement means the activities and research are carried out with or by members of the public, and again touches on a lot of what Jan and co were talking about earlier, rather than to, about, or for them. Members of the public are actively involved in the development, running and management of research projects or activities. And that definition is from the NIHR, National Institute of Health and Care Research, who I'm assuming everyone is familiar with, but it's okay if you're not. Oh, yes, of course, Shayda.
Sorry, just to jump in on that as well. There might be an instinct to think that, oh, well, one is better than the other because involvement is sort of with and sort of by and not like 2 or 4, for example, and engagement seems maybe a little bit more passive, and it is, but it doesn't quite work like that. I mean, we heard from 3 public contributors who said, this is my job. I want to do this and I have the time to do it and I want to be super engaged. But then there are groups, for example, NGOs, advocacy groups. I do a lot of work with those and they cannot offer that time and they don't want to offer that time. They want to have a mechanism to meaningfully involve themselves in a way that works for them, but they might not have the time or be bothered by filling out an evaluation or co-authoring something. They might want to, but they also might not want it. So it doesn't really mean one is better than the other. It's all about purposeful engagement or involvement, and doing kind of what's right for all the parties involved and for the project.
And that includes you as well, because as a researcher, as someone working with data, you might not really feel confident or feel supported or at the stage to really do involvement at every stage of your research, but doesn't mean that you shouldn't or can't interact with the public in other ways just to get your confidence up. And that's what we're going to explore a little bit as well. So let's talk about audiences. That segues really nicely. I'm going to do a bit of a double act. So audiences. Now, this is a little diagram that is something that I adopted from my time at the British Science Association. So the British Science Association, for those of you who don't know, are a small charity that I think punches way above its weight. And I was very fortunate to work there for 5 years. And I would say I cut my teeth with engagement there. And to really understand how their programs were reaching different kinds of audiences, they created this very basic but very useful model that I have taken with me to every job that I have done. And essentially it breaks public audiences or just audiences in general down into 4 kind of key categories. Now, you may agree with these, you may not, but it does really help you to kind of understand the different people that as someone doing engagement or involvement are going to begin to interact with, and therefore help you kind of understand how you can maybe curate an approach that would be suitable for them. So, and these are just some pictures from some of the work that I do at HDR UK that sort of caters to these different audiences. So I'll come over here. So our kind of most engaged / involved people are professionals. So when we talk about professionals, I'm talking about the researchers, the people who are very much curating and producing the scientific knowledge. And in terms of HDR UK and as a public engagement professional, we support early career researchers, but not even just early career researchers, all kinds of researchers to build their skills with engaging with the public. So here is a science communication training session he did, but also providing very practical opportunities. So we were going to different science festivals and we were making sure that researchers were involved in delivering activities. And here's just a really nice photo of a man asking one of our researchers something on his phone, probably about data or probably nothing at all about that. But it just, I think, all of the experiences that we had with the researchers there said it was really valuable. And I think that's a good example of where, while that's not public involvement in research, it's a very nice opportunity to start getting those kind of gentle conversations going with the public and getting confident with that. Then, you have your kind of second tier of like engaged people. So these are the people who aren't necessarily researchers, but they are enthusiastic about data or science and actively seek out information events. So these are the kind of people who would potentially come to science festivals. They're coming to your webinars. They're signing up to your public involvement panels. They're doing all the stuff that, our public colleagues were talking about earlier. So they're very enthusiastic about it. They want to spend their time doing it. And I think for me, these are great and I love working with all these people. But what I kind of been doing a lot at the HDR UK recently is kind of focusing on this sort of audience. And I think this is really the inactive people who are interested, but they don't really go to seek it out. They're not signing up to your panels. And even these people who really just don't see it as for them, it's not something they want to engage with. They're not bothered. They've got other stuff going on in their lives. So we're really thinking, what does it look like to meaningfully engage with these groups? So beyond Science Festival, starting to just going to like community events. So this was an event called Broadlands Fun Day in Wales, and it was lovely. There was carnival rides, and we actually had a really fun day. But so in terms of reaching these audiences, it's really about thinking, where are they? Who are they? How can we get there? And I'll also talk about our community engagement program, Take the Lead, which we launched last year. A bit later on, but this was very much around directly funding community groups to just explore data in their communities as a way to get comfortable with this idea of data as a concept and what it really meant for them to be able to use it. And as a result of that, we've sort of been able to bring them in to the fold of HJK a bit more and learn from them as much as I think they've kind of gained confidence from us as supporting them as well. And I'll just touch on a report that we did earlier last year, which was just exploring public attitudes to health data research across the UK. If you're interested in understanding who might be underserved in health data research or anything like that, I'd give it a read. It's really accessible. It's a very whistle-stop tour, but it was just a piece of desk research that we did that helped inform, when we talk about underserved audiences, what we mean by that. So I'll stop talking on that now, but hopefully that will help a little bit. And I'd really advise you to go and check out the audience model by the British Science Association, because it does just help communicate, you know, your thinking around what we talk about public audiences. So, is this me or you? Okay, I'm going to hand this over to Shayda now because I need a break.
Okay, so we had a really excellent question earlier on a challenge in public engagement. So it would be really helpful to hear from you, very honestly, what's a concern that you have around doing public engagement or public involvement?
It will delay delivery.
It'll delay delivery. Okay, cool. Anyone else? Yes.
Once we've got engaged, we have nothing more to offer.
Okay, yeah, that's a really good one. So once the project's over, there's not more to give them. Yes.
People that we engage on sensitive people that we might want to get. Like the thing about getting interested, educated people, they're the people who are likely to respond to requests to be involved.
Yeah, that's a really good one actually. We had a public dialogue, and we in 2022 we engaged 78 members of the UK public, and we had an example of a harmful use of statistics, which was the Brexit campaign, the 350 million on the big red bus. You know, not a single Brexit voter was in the room. Yeah, and that's when I realized that, you know, we try really, really hard to, we might tap into groups or people who are really familiar with the space, or groups of people who are not, but there's still people who may choose not to engage, we don't. I know Jan said it's hard to reach is not a good way to phrase it, but we can't reach them. Did you have a hand that was going up? Yeah, sorry, or maybe you were shuffling around. Sorry, Catherine.
Finding the time to do it properly.
Finding the time to do it properly. Yeah.
Sort of similar to that is not sure what the don't know how to best use their time, so worried about wasting their time.
Right. One back there.
Not having the funding to sustain the relationship.
Yeah. Cool. You're all warmed up now. I'm seeing a lot of hands. Okay, I'll take two more.
So there's a lot of reasons not to do it.
Yeah, I'll take two more, but and we'll try and address some of these, and whatever isn't addressed, we'll have plenty of time for Q&A. So yes and yes.
One of the challenges we find is taking principles of good PPI practice, which developed in academia, and applying them into the commercial research setting.
Oh.
Where co-development from the outset can be quite challenging when we didn't set the research question, we're commissioned to deliver a research question on commercial partners' behalf. That can be quite challenging.
I have a similar sort of thing as well, so maybe we can chat later. Yes.
And the kind of similar to Catherine's, I think time, but the ratio of spending time getting people up to speed and getting understanding versus talking about this with actors to get want to engage on or find out about.
Yeah, totally. And I hear that a lot, like getting people up to speed feels like a huge barrier. And actually, I'm very happy to talk about this later too. We piloted a public panel of people who had never engaged with data research before. And we had them on for 2 years and it worked really, really well. And we now have the new cohort and we had our first meeting in March and we were just like, oh, how's it going to go? But it actually went really well. So it isn't necessarily as challenging as it can seem. But okay, so we had to think about what challenges you might think of too. And not everything that you said is up here, but this is sort of what we thought are some common challenges. So who to engage, how to engage, when to engage, how can I do it well, where can I get support, how can I find time, who is the public, why engage. And yeah, we'll have plenty of time for Q&A afterwards. Do you want to know? Oh, no. Okay, cool. And so we just kind of thought, well, here's what we would respond. So when to engage is sort of as early as possible and across your project lifecycle. So you mentioned that, you know, it can be really tricky because sometimes you're given a question that isn't co-produced. We have sort of similar challenges at ADR UK as well, because we've got administrative data sets that have the potential to answer so many amazing questions and do so much interesting research, but they're also super limited. So if you ask a group of like community experts, for example, who work in the field that the admin data came from, you know, what are the most pressing questions on the ground? You'll get loads of excellent suggestions, but the feasibility of that might not be possible. And so I reach that roadblock quite often in my work. And so I'm just really honest and just say, look, I couldn't bring you in before, but I'm bringing you in now. And this is what we can do. Are you interested? Yeah. Okay, cool. Let's do it. You know? And then, so why engage? So it's kind of like when you think about like, why am I doing this? It's kind of like, what do you want to learn or what impact do you hope to achieve? Who to engage is around like who, sorry, these are kind of questions. I don't know if they're quite answering the thing, but maybe they are, because it's getting you to think. Exactly, it's getting you to think. So like, who do you need to speak to and how do you reach them? How and sort of like there was a sort of comment that was made earlier by one of our public colleagues, which was on you know, people are naturally grouped. And that happens a lot. Like you've got lots of like patient groups, community groups, charities that have their own like advisory groups. And so those are really, really good resources to tap into. How to engage. So sort of what do you want to achieve? There were some really excellent examples in the earlier sessions around accessibility and inclusion. And how do you know you did it well? So that was sort of what we alluded to earlier around being purposeful with who you're engaging. So that sort of definition between engagement and involvement is like, you know, the sort of reason you're engaging and or involving and who you're sort of targeting will kind of help you think about what the most appropriate activity is. And then being transparent and accountable. Who is the public depends on the context. So sometimes it might be the general public, sometimes it might be a really specific group. Sometimes it might be a public contributor that's been working in research for, you know, 20 years, and sometimes it might be someone who's just, you know, who hasn't done this before. How do I find the time? So yeah, plan your public engagement into your project from the beginning, and then where can I get support? So yeah, we're going to talk about that. So one of the things is the PEDRI good practice standards. And I think PEDRI then has kind of been thrown around a little bit, but in case people don't know what PEDRI is, it's a sector-wide group. It's kind of like a super group of different organizations, programs, institutions who are working on data research and are really interested in involving and engaging the public and doing it meaningfully. This started in 2021 as just a conversation with the national statistician at the time around how if we aren't standardizing our approach to public involvement and engagement, then if one of us appears not trustworthy, we all seek to fail, because it's not the public's job to distinguish between us as different groups and programs. We're all working in this sort of space of working with public sector data for research. And so we had a lot of internal conversations, and we kind of thought, well, how do we kind of go about this? And we realized that actually there's a lot of guidance out there around involving the public with health data research, but not so much with other types of data. And that was a really important gap that needed filling. Why? And it's because when you're talking to someone around health data, especially if they have experience of that health condition or sort of experience of that world, it's a lot easier to sort of have something tangible to latch onto. The language maybe even can be a little bit more technical because the member of the public is comfortable in those medical settings, whereas when you're engaging with sort of, I don't know, different avenues like or different sort of contexts like care experienced young people or maybe justice system users, it might be less it might offer sort of new challenges in finding common language, as an example, or even getting people to care. So health is something that might feel a bit more relatable than sort of other areas of work. And so thinking about, the so what and how do I communicate that and the why can be different in sort of different contexts when it comes to different types of health data. And so we felt like we really needed some guidance that was for not just health data research, but kind of more broadly. And so that's where the good practice standards came about. And it was the product of a lot of consultation. I mean, lots of in-person consultation, online consultation, several rounds of surveys, many iterations. I think it took like 2 years even to publish. And it is a sort of evolving project, really, that's expanded so much more than just the standards. And there's people in this room that have been involved with PEDRI along the way. So yeah, I would definitely encourage you to scan that QR code and find out more. And make the pledge. If you want to aspire to do meaningful public involvement and engagement, make the pledge. As someone who was lucky enough to be in those very early conversations about PEDRI up until now, PEDRI is a place where you just come to try. It's safe to try. It's not about doing it perfectly. Okay, so does anyone want to share some experiences of working with the public in data research just very quickly? Yes.
So thank you very much. So I manage our Patient and Public Advisory Panel, which is a group of 12 beautiful, very, very generous, predominantly patients and members of the public who advise us predominantly at the strategic and tactical level of our research operations, taking on a lot of lessons learned from PEDRI early on in the formation of that. We meet quarterly, often between 7 and 9 in the evening, because that's when they're available. And their involvement is, at this point we've been going for about a year now, but in terms of where we operate, we do a lot of work at this tactical layer where they do things that will be familiar to a lot of people in terms of patient and public communications, participant information sheets and that kind of thing, but are also getting into quite a niche area. So as an example, one of the things that I ask of our researchers is that for every research project, they produce a lay summary, but due to our efforts to scale up, we're now exploring what does that look like if we're producing lay summaries using generative AI to take a research proposal protocol and create a 200-300 word subset, which means we can deliver that information much more quickly than if we were to do case-by-case engagement. And so we're producing a guidance document for researchers, but it's being co-produced with the advisory panel so that gets rolled out every single time. So every single project, although it doesn't have that one-to-one interface, always has that involvement and that guidance from patients and the public in that space, as an example. And that's one of the challenges as a SME organization. We're very lucky to have the funding to maintain this ongoing panel. but how we use them, we have to be quite tactical with, because we just don't have the funding. So that's how we're trying to balance it.
That's a really good example. And I think that's a really good example of highlighting the adaptability and fluidity that public engagement has too. So you might have, like in a project or sort of on the outset when you created that panel, had a vision for their involvement in sort of your work, and then over time, you know, you've had to sort of respond to the environment that you work in, and that's kind of very true to the way public engagement and involvement works. Cool. I'm going to skip ahead, but then if anyone wants to share any examples, Anna, did you want to come in as well? Okay, go.
No, it's just really interesting hearing your experience of it. What organization are you from? Okay, yeah, and I think it's interesting having. You'd call yourself industry, right? In the room? Yeah. And I think that's interesting because that kind of perspective is like rarely in the room when we have these conversations as well, and so it is. Yeah,
I think it's about the point. I've been involved in a couple of Federal initiatives.
Yeah.
And one of them is the taking how do we strengthen PPI with an SDE environment. Yeah. But within that context, so much of what would be expected will fall on research of the applicants. You build the structures from which they will be directly affected by. And it turned out in the wash that in terms of the survey, what do you think based on the feedback we're getting? No one from industry responded, none of the researchers did. I went nuts and said to our researchers, where are you? What are you doing? You need to get involved in this, otherwise it's going to happen to
you.
So as much as there is, you don't want research to happen to people, as you're bringing members of the public in, the pendulum swings the other way.
Exactly.
So my big passion is bringing these people.
Yes, and I very much see our role as a broker role in that way, and I think that's why that audience model that I was talking about earlier involves the professionals as well, because you can't just kind of go one way with the public and then leave all these other people behind, which are like delivering the research. And yeah, that's why I love my job, is because you kind of are having all these different perspectives and things like that. Do you want to do the reality check? No, you can. Well, there's a reality check here. So probably what you've realised from this, and anyone who's done it themselves, is that public involvement and engagement can take time. It is often under-resourced, and it can also be resource intensive. And so you've got an imbalance there where there's no resources and it's resource intensive. So often you might feel a little bit tired after it. And I'm sure there's anyone who's a researcher, even without doing public involvement, anyone who does work in public involvement engagement will have felt more than once the toll that can take sometimes. But I think we're all here in this room, we will come back to it because it is worth it. And the real impact that it can have, even just from that one interaction at a science festival, right through to involving the public in your research from beginning to end and doing everything absolutely amazingly. I think it's absolutely worth it, not just for you and the research, but also you heard from the public members, like this is in many ways life change for them and allows them to be a part of something bigger and collaborate with people you wouldn't have collaborated before. So it is worth it. And there is loads of resources out there for you to look at, depending on the level that you're kind of wanting to enter it at the moment, and we will go into that. But before we do that, we do want to touch a little bit on some of the work that we've been doing just to put some of this into context. Obviously, we're not researchers ourselves. We work with lots of researchers and probably have hundreds. Are we going on the thousands at this point between us, maybe, across our jobs? But I would say the example that I'll touch on definitely is around that kind of brokering opportunity, where it's like, you know, I have this luxury of being able to think purely about the audiences that I'm trying to work with. I'm not delivering a research project at the same time. So how can I help you? How can we help the researchers who don't have that time to kind of start getting newer people into it and to get more diverse voices in? And I think that's what both of our examples are really about. So Shayda.
Yes.
Is that?
I don't. Oh. Okay. Yeah. So I'm gonna kind of walk you through some public engagement that sort of I've been doing with justice intermediaries that had a lot of reality checks. So if we go way back to the AGI UK pilot period between 2018 and 2021, we were funding these like Whitehall linkages, and the health to non-health linkages were doing some incredible public engagement, but the non-health linkages were not. And so we realized like we need to be doing that. And to kind of highlight our justice one, we had this, at the time, it was like this incredible project. It was called what's called Data First, which maybe you've heard of, which is the linking together of justice data from the different courts. And Lizzie's back there in the room. Lizzie Wayne from DARE, but at the time we were both the comms officers at ADR UK. And I remember when we, do you remember when we put the embargo out for the press release that Data First were doing this thing. And I remember like, we were like, oh my God, like the next day, we're gonna get so many questions from journalists that we're linking this justice data. No one cared, but it's actually a huge project now. So anyway, this was like a pilot phase. Like what would it look like if we linked together data from across the justice system, right? And so we decided to do that, and that agreement was signed in 2019. And then after that, we were like, okay, we need to engage the public. So we had some conversations with MOJ, and it was agreed that we're going to do this through intermediaries, NGOs, advocacy groups, charities, those who can represent the needs of justice system users. And sometimes there is some crossover, because sometimes in that world of work, you have people who have that experience as well, who then choose to go into those professions. We just felt like we couldn't do that direct engagement responsibly and sort of safely. So we thought going through intermediaries is a good idea. So we created this panel, the it was called like the user representation panel in 2021. We offered them some honoraria that was in line with the NIHR rate at the time. And we had our first meeting after we'd signed the agreement to start this linkage, but before we had really done anything else. And we kind of thought, oh, this is going to be great. And that meeting was so awkward. It was really uncomfortable. We told them, oh, we've done this thing. And we thought that we would get feedback like, wow, I've been waiting for this and thank you. But actually they were just like, okay, what do you want from us? You didn't ask us that you wanted to do this, and now you've done it. And why are we here, kind of thing? And that was a huge reality check where it's like, okay, if we're gonna bring everyone together, we need to use their time in a way that is mutually beneficial. We need to know, like, why are we engaging? We can't just be like, hey, we did this thing, please approve it, you know? So we didn't do any more engagement until we had the first until we were ready to fund some of the first users of this data. So we had some Crown Court data and Magistrates Court data were now like ready to be analyzed. And so I thought, okay, now I'm going to reach out to the group again. So I set up a roundtable online between the group and some colleagues from the Ministry of Justice to talk about what's in the data set and, you know, what are some potential questions we could answer. But again, even though there was the best of intentions, that meeting didn't work either, because we got some excellent feedback that the data couldn't do anything with. And the meetings ended up still being a little too technical for the audience. So after a few rounds of those types of meetings, they stopped. So then I tried again. So then when the first set of fellows were in post, I thought, okay, well, it makes sense to me for them to present their project plans, like what their research questions are, their motivation, their plans for dissemination and impact to this group. And maybe at this stage, we can see some like co-working start to develop. And actually that did work. That went really, really well. And out of the 4 projects, one of them did end up tweaking their research questions as a result of the feedback. And so what I sort of thought was, these fellowships are short. So I didn't mandate, I just sort of said, like, meet with them at the beginning, meet with them when you've got some preliminary results, meet with them at the end to sort of close that loop of, you know, this is what we've come out with, and like, let's have some conversations around impact. And I saw them over the course of the sort of roundtables that I set up. There was a lot more sort of emails behind the scenes, and relationships formed like after the fellowship was completed. And I'm still working with those intermediaries, some of the same ones now, several years on. And we kind of like, in responding to your question, there is this, like, I really want to involve these intermediaries sooner. But there is that sort of awkwardness where administrative data is still quite limited. And so this year I'm piloting something new where after speaking, checking in with my intermediaries from time to time, I've received feedback that, you know, it's great, thank you for involving us and, you know, all of that, but that it still feels extractive. So now what I'm piloting is once we have the project summaries of the projects that are going to be funded, I'm going to have a discussion with the intermediary groups on those project summaries and what they want their involvement to be like. So rather than the researchers presenting what they're going to do, the intermediaries will see will get a sneak peek in advance, so that when they do finally meet the researchers, they already know what the project is about, and they can come in and have a more of a collaborative conversation rather than hearing it for the first time. So this is sort of what I've been doing here with just as an example with our justice intermediaries, but we have another sort of group that focuses on children and young people as well. And over time, we started getting fellows outside of justice and outside of children and young people. And so my work with them is sort of kind of passing on the lessons that I've learned and helping them create their own advisory group of intermediaries. And I feel comfortable sort of advising on that because I've had to do it myself. I've had to call, draft those emails and sort of try different ways to figure out what feels mutually beneficial. And yeah, so I wrote a case study on it. It's on the ADR UK Learning Hub, and you can catch me afterwards if you want to sort of talk about that.
Thanks, Shayda. I feel like we're doing a weird kind of comedic act, aren't we? Thanks, Shayda. That was really. I actually didn't know all the detail about that. But yeah, I think the iteration is the key. The key here is like, if you don't succeed, try again. Try again. And yeah, I think that's just my story of public engagement, my life. So yeah, my example is a little bit different from Shayda's in the sense that it's not really about a public panel. It's not really around like a data set. It's more just kind of a broad approach to getting people comfortable with this concept of data and public data and big data. So we're kind of starting really from the beginning. So again, cast your mind back to the slide about the audiences. And when we're thinking about who I'm really trying to reach in my work, it's that kind of inactive, the people who would class as underserved, hard to reach, people who aren't, knocking at your door to get involved in research projects. Not that there's that many people there, but they're out there, they are. So when I started at HJUK, coming on 2 years ago now, one of the main things was like, we're going to science festivals. This is our first kind of foray into public engagement. And with my background being science festivals, I was like, this is great, I love it. But you're only ever going to be so limited as an organization if you are putting a lot of energy and effort in going to different science festivals across the UK. And while we have a good public involvement team in terms of size, it's still there's always limitations on that. So I was really thinking, how can we kind of take the concepts and ideas that HJUK have kind of gathered from going to science festivals, talking to people, actually going out of the office, getting offline, and how can we make that into something that is national and that we don't have to do the engagement and deliver the engagement. So this is where this concept of take the lead came from. And really the concept is simple and not new. I guess the newness is that it's being applied in data research spaces, but essentially it's supporting communities with small grants of up to £1,500 to just explore and celebrate data in their communities and how data can improve health and well-being for their groups. So we spent, the biggest difficulty with this wasn't actually getting groups to apply, because we ended up having 500 applications from across the UK from community groups who were working with various different underserved audiences. It was more creating the documents that came from an organisation like Health Data Research UK, which is very focused on supporting good data research and academics, and adapting all of those kind of processes and things to focus and be appropriate for a community group who's has no concept of like academic language and the funding process and all this kind of stuff. And what I will say is that I was very fortunate because there was a lot of flexibility internally. And I think that is my number one learning, is that there is a lot of processes involved in just being able, like even just being able to ask the question, can we fund community groups? Like that is a big thing. Unfortunately, HDR UK said yes, which was great. But then all the other data around developing guidelines, you know, creating the right funding form, making sure that there's not too much burden on the evaluation for groups because you're only giving them £1,500. Like it's more than just giving the money, it's the process as well. And then the support you give afterwards. So we've literally just finished the first project delivery period for Take the Lead, because we launched it last year. We ended up funding 26 communities across the UK, and here are some photos just from it. So this was a dementia group who was doing some health journaling. So just to say that when we were talking about health data and data supporting health and wellbeing, we really were talking about it in the broadest sense. We weren't just saying, you know, have a discussion around privacy and NHS data. It was like, well, you know, journaling's a form of data, and just, you know, step counting and all this kind of stuff. So that's why we've got a journal here. We've got a girls' football club who are kind of counting their health statistics after playing football, more journaling, walking, and then a group in Northern Ireland, a Romanian group in Northern Ireland, who were doing step counting between how many steps it takes between finding different types of flowers and then like discussing that afterwards, which was really lovely. And I was very fortunate to actually go and visit all these in person. We worked with an amazing photographer as well, which again was very lucky. We had some underspend, so I was like, I want that money for a photographer. But really why I'm talking about this is kind of what I touched on earlier, is that, you know, this kind of program is only really possible as someone who's focusing on doing this as their full-time job, which is me. But really what is designed for is that these groups now, we would never have had any reason to interact with these groups before Take the Lead. But actually now 26 groups across the UK, including all 4 nations, we've got this really good relationship with them where, you know, if there was an opportunity, we could reach out and say, is this of interest to you? And they would say yes. Whereas like before, cold calling groups like that, they're just like, no, you're just another person. And I think it's really around it's the trust, it's the slow relationship building. Realistically, we've been building the relationships with these groups for the best part of 6-7 months. We've visited them, we've given them photos for their groups, because we've not just taken these and said, you can have them as well. And so it's kind of beyond that funding. What is it that you can offer them? What is it that you're giving each other? And where can that go next? And I think that's the kind of interesting question we're at now. It's like, where can this go next? You know, I don't have any immediate opportunities to say, okay, you've done this, now get involved in this. But the plan is to kind of just maintain that relationship, have check-ins, keep them as part of like almost this alumni network. Potentially, you know, if we can get some more funding in the future, provide further opportunities for them to develop, because we have had a number of them saying they're really interested in staying in touch. And we will be putting out an evaluation for this towards hopefully by July, but we'll see. But yeah, it's been a really, really interesting process. And I think one that hopefully is going to be helping people like yourselves to access new communities in the future. So I'll leave it there because it is now 10 past.
Yeah, I'll just really quickly say as well, this is a really good example. I mean, this is an excellent piece of work, but it's not something that ADI UK would be able to do. Like, we couldn't fund communities directly ourselves. And so it's, you know, like sometimes you'll want to do something, but it's also about working within the restrictions or limitations of the space that you're working in. But I think both of the examples really highlight that it is important to talk about the challenges. It is important to communicate that, you know, we didn't reach this shining gold example of public involvement or engagement overnight. Like, we tried and tried and tried. And so, like, if you ever, you know, you're in good company if you ever want to kind of talk about those things.
Or cry.
Or cry.
So these are just a couple of slides on resources, but I think we can just share these with you afterwards because there's there's QR codes and stuff, but essentially there's loads of resources in Pedri. We've got webinar recordings that, anything from working with young people right through to arts-based approaches, things like that. And then there's also resources from HJUK as well. Actually, can you go to the HJUK one? Now, this one. So I mentioned that we're working with communities, but we're also really wanting to work with any researchers who are interested in supporting community engagement. HJUK, you don't need to be a health data researcher. Yes. So if you are interested in joining our new engaging data researchers list, this is for UK-based data researchers, including data scientists, statisticians, and analysts from PhD and above, interested in supporting our public involvement and engagement initiatives. So whether you might be interested at some point in being partnered with a community group or want to do a webinar or something for us, then sign up to that. We'll ask for some information for you and match you with opportunities. And then also we have HJUK Voices, and this is essentially a network of public members. So if you have any involvement opportunities around health data, get in touch with us, and I can send it out. And we have, I think, over 400 people on that list now. We helped Joe secure some people as well. And I keep getting emails from public members being like, can I do it? I'm like, no. But they're keen. That list is keen. So definitely if you've got opportunities, send me an email. But yeah, beyond that, I think it's time for
Really quick
questions. Sorry.
This is from ADO UK as well.
Oh, yes, sorry.
Slow down. Okay, so we have something called the ADO UK Learning Hub. So that's the QR code for it. And there's case studies, and they're written in sort of normal language, of just kind of like, why did you do it? Literally, why did you do it? What did work? What didn't work? Who to contact. So if I'm reading the case study and I want to know, because when I first joined, I had to do public dialogue. And I was like, well, no set of guidelines is helping me with that. So I literally Googled UKRI public dialogues, found the people who did them and emailed them. And I asked them, like, how do you literally commission a company to do dialogue? And that's what I want the case studies on the Learning Hub to offer, like practical information. So it's there. And then also each case study has the email address of the person who's written it. So touch base with them if you want to learn more. We also have our own public panel, and I think it's so awesome that yours meets in the evenings. I'd never heard of that before. Ours does too. So we meet in the evenings every 2 months. We fund it. So if you want to engage with it, please send us an expression of interest to do so. And yeah. I think that's it. And then there's Pedri webinars available on the HDR UK YouTube channel. So and loads of other resources too.
Okay, I think that's it now.
Yeah, sorry.
Thank you so much. Yes, I rate it. I tried it. Got over 190 people signed up to a 15 people event.
Yeah, that is one of the
great.
problems actually. But...
Yeah. Do we have our own health data festival that's coming up in maybe September?
So we do. We have not quite a festival, a forum.
Yes.
The Pedri Forum. So yes, oh my gosh, terrible communications. So actually we have a Pedri Forum coming up in December in London. So just down the road from here, Welcome Trust Building. And this is our first conference that Pedri are running. It's going to be all things public involvement, engagement, and data research. So if you're a researcher, which you probably are, or even a public member, or you're a researcher and work with a public member and you want to come, this is really going to be the place for you. It's our first one, and yeah, it's going to be great, honestly. So come along.
If you like the style of presenting.
Yeah, if you love this, you're going to love.
Yeah. And we've got a webinar coming up soon as well.
Great. Any questions from the floor? Yes.
Thanks, Anna. I was just wanted to ask a question about the Pedri standards. One of the things I've noticed that's sort of doesn't seem to be explicit in there is the role of patient public involvement in governance, which I think is explicit in some of the other kind of standards that are out there. I'm just wondering how either whether it's sort of it is in there, sort of perhaps more sort of buried, or whether it was a conscious decision that that's from the data space that perhaps wasn't where the conversations got to. Just interested to know.
Yeah, no, it isn't in there, because it's not all PEDRI members, it's a possibility. So ADR UK is a good example of that. So we have data centers that we work with, like the Sale Data Bank, and they've got their sale public panel, their consumer panel involved in everything. Whereas the ADR UK Strategic Hub, where I work, we don't do that. And it's not something that it's one of those challenges that we have in the way that we do and can and can't do public involvement and engagement. And I think the sort of motivation behind the standards was we wanted to, and they were co-produced with the public. Like Jan has been with us for a long time, working with us in developing these. But I think what we wanted to produce was something that was not unachievable. Like if you are doing this, like it doesn't mean that you belong in the club, and I think that's really important. But you are right to point that out, that like, you know, and I guess that maybe that's also that sort of speaks to the conversation we had a little bit earlier between like public engagement and public involvement too.
Thank you.